हेलो। आज का टॉपिक हमारा रेडियल नर्व। आज का टॉपिक है हमारा रेडियल नर्व। सो फर्स्ट ऑफ ऑल आई विल टेल यू सिंपली फ्रॉम वेयर द रेडियल नर्व अराइजेस. सो रेडियल नर्व इज अराइजेस फ्रॉम द your posterior cord of the brachial plexus. Posterior cord of brachial plexus. Okay, it's the longest nerve of the your forearm, your upper limb. Longest nerve of your upper limb. Okay, longest nerve of your upper limb. So it's arises from the posterior cord of the your brachial plexus. It's a root value C5, C6, C7, C8 and T1. Okay, all of the brachial plexus root value, that also root value of your radial nerve, C5, C6, C7, C8 and T1. Okay, your root value of the your brachial plexus. So it arises from the your posterior cord of brachial plexus, longest nerve of your upper limb, and it is also thickest nerve and longest nerve of your upper limb, and it is arises from your posterior cord of brachial plexus, root value C5, C6, C7 and C8 and T1. After arising from the posterior cord, it passes behind the your third part of axillary artery. Passes behind the third part of axillary artery. Passes behind third part of axillary artery. Okay, then it's passes along the your posterior wall of the axilla, and that is made of your subscapularis, teres major and subscapularis, teres major and latassimus dorsi. Then it passes a triangle inferior, that triangle made in inferiorly passes through that triangle with the your profunda brachii artery. It passes in the triangle with the profunda brachii artery. In the lesson of profunda brachii artery, that triangle made up in upper word of that triangle made of your teres major. Laterally it made of your long head of triceps, medially your shaft of humerus. Okay, so this is the upper relation of your brachial, your your radial artery, radial nerve. Upper relation of your radial nerve. Okay, upper relation of your radial nerve. Okay, after that it passes like this. So from here it's come like this, here it's come like this, and passes in the your spiral groove. Passes here in spiral groove. Radial nerve passes in the spiral groove. Okay, then it's come anteriorly. From posteriorly it come to the anterior in front of your lateral epicondyle. Okay, lateral epicondyle in front of anteriorly to the lateral epicondyle passes. Then in the this your cubital fossa is divided into two branches, superficial radial nerve and the deep branch, that is called your posterior introsus nerve. Okay, that is your superficial radial nerve and posterior introsus nerve. Superficial radial nerve is yours purely sensory, and deep branch, that is your posterior introsus nerve, that is purely motor nerve. Okay, so first of all we make a rough diagram here. Suppose this is your humerus, a rough diagram of humerus. Okay, then let's make your nerve coming the axilla. It's come like this, coming axilla come like this. Okay, then coming front, and then front coming to the your, this is your spiral groove, and this then in front of your lateral epicondyle of humerus. So in axilla, the nerve supply to the in axilla here, the nerve supply to which muscle? It's supplying axilla, long head of triceps, long head of triceps, and medial head of triceps. Medial head of triceps. Okay. Okay. The down when it's come to the mid shaft, it's also supply your mid shaft. It's supplied to the lateral head of triceps, and as well as medial, again it's supplied to the medial head of triceps. Okay, triceps. So radial nerve you can call is this nerve to the extensor nerve also, because it's exclusively supply your your extensor compartment of your arm and forearm. Okay, your posterior or extensor compartment. So its job is only to do extension at the elbow, wrist, and fingers. So this actually you can call this nerve as a extensor nerve. This is your extensor completely. It's involved in extensor of your elbow, your wrist, your fingers, all this. Okay. So this is mid shaft. Here it supply this. Then it's come in front of, before it's coming in front of your lateral epicondyle of humerus. It supply somewhere here. It supply to the, before coming to the lateral, in front of lateral epicondyle of humerus, it supply to the two muscles, that two or three muscles, that is your brachioradialis muscle, your brachioradialis, your extensor carpi radialis longus. Okay, then one muscle, one medially it's also supply one muscle, that is your flexor compartment muscle, that is your biceps brachii. It also supply biceps brachii. Okay, before entering into the your cubital fossa or your in front of your lateral epicondyle, it supply these muscles also. Okay, brachioradialis, extensor carpi radialis longus, biceps brachii muscles. Okay, this muscle is clear. Okay, then we go ahead. So we discussed muscle supplied when it's enter into the axilla. It's supplied to the long head of triceps posteriorly. Okay, so it's a nerve of posterior compartment. So it's supply posterior muscle, your long head of triceps, your medial of triceps in the axilla. Then it's coming down somewhere mid side. It also supplied your lateral head of triceps as well as medial head again. Then it's coming before it's just before it's coming here, somewhere here it's supplied to your brachioradialis, your muscle like your brachioradialis. Okay, your brachioradialis, your long head of your long head of uh, sorry, brachioradialis, and your extensor carpi radialis longus, and your biceps brachii. Okay, so again in axilla it's supplied to the your long head of triceps, and your medial of triceps. Then coming mid It supplies to the as well as to lateral head of triceps as well as medial head of triceps. That before coming entry into the your cubital fossa or in front of the lateral epicondyle, it supplied to the your brachioradialis, your extensor carpi radialis longus and your biceps brachii. Brachioradialis muscle. This is your somewhere. This is your brachioradialis. Okay, this is your brachioradialis muscle. Okay, somewhere this. I'm not that muscular. So this is your brachioradialis muscle. Okay, brachioradialis muscle. It's applied before entering to the your in front of your lateral epicondyle of humerus. It's applied brachioradialis. Okay, brachioradialis extensor carpi longus. Okay, extensor carpi longus and your biceps brachii. Okay, brachioradialis extensor carpi longus muscle and your biceps brachii. It also supply your biceps brachii before entering into the in front of your lateral epicondyle of humerus. Then after coming to the your lateral epicondyle of humerus. So this is your humerus muscles, your humerus bone, suppose. So after coming to the okay, I'm not that great in drawing actually. Okay, so after this nerve, after coming, so like this is coming, then here in front of that, then after coming in the forearm, it's divided here in the your cubital fossa into two branches. One is your superficial radial nerve. Other is your posterior introsseous nerve. So before it's become posterior introsseous nerve, their deep branch, deep branch is posterior introsseous nerve. Your superficial is your superficial radial nerve. Before it's entering into the your forearm through the it's suppose this is your this is your supinator muscle. So it's entering through the supinator muscle by piercing the supinator muscle. It enter into the forearm by piercing the supinator muscle. Okay. So before entering into supinator muscle, it also supplies the supinator muscle. It also supplies the supinator muscle. Okay. It also supplies the supinator muscle. One muscle I forgot to say before entering its supply. I told you before entering to the in front of your lateral epicondyle supply to the your brachioradialis. Okay, your extensor carpi radialis longus, your muscle is here your biceps brachii as well as anconius muscle. Okay, anconius muscle, that is your posteriorly one muscle is there, anconius. one small muscle, your somewhere here, that also supply and conus muscles here only. So here, before entering piercing the supinator, itself it supply the supinator muscle. Okay, as well as this, other than supinator, it's supply which muscle over. Other than supinator, it supply which muscle. Other than supinator, it supply here. Other than here is supply supinator. Okay, supinator muscle before it piercing the supinator. Then here it also supply your one more muscle, that is your one is this is your extensor carpi radius longus. One other muscle is your extensor carpi radialis brevis. Brevis. Okay. Extensor carpi radialis brevis. Here it will not supply. It's only here supply extensor carpi radius longus, brachioradialis, biceps brachii, and anconeus. But here it's supply before piercing your supinator muscle, your posterior introsic nerve before piercing your supinator muscle. It supply your supinator muscle as well as your extensor carpi radialis brevis muscle. Extensor carpi radialis brevis muscle. Okay, up to here is clear. So after this, when it enter into your forearm, after entering through piercing the supinator muscle, it's your deep branch, your posterior introsic nerve. It supply many muscles in the this compartment. I'm making this wrong. This compartment, this compartment, it supply many of muscles of your extensor compartment, all muscles of your extensor compartment. Okay, after entering piercing through the your supinator muscle, piercing through your supinator muscle. Okay, your posterior introsic nerve supply which muscles? Posterior introsic nerve supply which muscles? In the your extensor compartment of your forearm. Which muscles supply your extensor digitorum, extensor digitorum, extensor digital minimi, extensor digital minimi, extensor digitorum your coming from like this. This your extensor digitorum coming here, all these fingers, extensor digitorum, then extensor digital minimi, extensor digital minimi. This is extensor digital minimi, extensor digital minimi, extensor digital minimi. Okay, extensor digitorum, extensor digital minimi. Then this is your superficial muscles only. Okay, extensor digitorum, extensor digital minimi, and extensor indices. Extensor digital minimi. Sorry, this is the extensor digital minimi. I made mistake. This is extensor digital minimi. This is your extensor indices. This is your extensor digitorum. All this is your extensor digitorum, extensor indices, extensor digital minimi. This is extensor digital minimi. This is extensor digitorum. This whole is extensor digitorum. This is your extensor indices. So this is your extensor digital minimi. This is extensor digital minimi. This is your extensor digitorum. Whole this extensor digitorum, and this is your extensor indices. Extensor indices. Extensor indices. These are your superficial muscle, deep muscles like your extensor pollicis longus, extensor pollicis longus, extensor pollicis brevis, extensor abductor pollicis longus, these are all the muscles also supplied by these muscles. Okay, extensor pollicis longus, extensor pollicis brevis, abductor pollicis longus. Okay, these are also anatomic snub box. Anatomic snub box. This is your anatomic snub box. This is your anatomic snub box. So this is medially, laterally it is basically it's two muscles, abductor pollicis longus as well as extensor pollicis brevis, and medially this is your extensor pollicis longus. Medially this is your extensor pollicis longus. This is your extensor pollicis longus. Okay, this is your extensor pollicis longus. This is your extensor pollicis brevis and abductor pollicis longus. Okay. This is your anatomic snub box. These big muscles also supplied by your radial nerve. All these muscles. Okay. Then in the end, your superficial radial nerve come in this anatomic snub box. It's end here. These are now we see the cutaneous branch. Okay, we see these muscular branch, cutaneous branch of your radial nerve. Cutaneous branch, one is your posterior cutaneous nerve of arm. Posterior cutaneous nerve of arm is supply your skin of your posterior surface of your arm. Then lateral cutaneous nerve of arm, inferior lateral cutaneous nerve of arm supply your lateral side of your arm. Then posterior cutaneous nerve forearm supply your skin back of your forearm as well as your superficial radial nerve also supply your medial two and a half, or you can say medial three and a half, skin of this your superficial radial nerve supply medial 3.5, 1 2 3 3.5, or sometimes 2.5 also can be seen, but it's basically 2.5, 3.5 you can say. Medial 1 2 3 3.5. These is supply your radial nerve only. So this skin here is supply your, except the nail beds. Nail bed is supplied by these nail beds is supplied by the median nerve, but below the nail beds here this skin is all supplied by your radial nerve only. Okay, radial nerve. Okay, so we see the injury of the radial nerve. Injury of the radial nerve. Okay, injuries of the radial nerve. Injuries of the radial nerve. Injuries of the radial nerve. Okay, radial nerve. Injuries of the radial nerve. First of all, we see the cruch palsy. Cruch palsy. Then Saturday night palsy. Saturday night palsy. Saturday night palsy as well as cruch palsy, Saturday night palsy, and then honeymoon palsy, as well as fracture of mid-shaft humerus, and fracture lateral epicondyle humerus. So these are the main injury of radial nerve. These are the main injury. Cruch palsy. When you use crutches, here it's occur. Okay. Cruch palsy. When you use these crutches, that crutches you use, you walking these. So these are you pressure here. So that radial nerve injury occur in the axilla only. Okay. Cruch palsy, Saturday night palsy also injury in the axilla. Saturday night palsy means when the alcoholic person or intoxicated person, alcoholic persons, when he, suppose this is the chair, when he sit and under influence of alcohol, he is sleep like that, and whole night he sleep like that. Then pressure on these here is causes that your Saturday night palsy. Okay, Saturday night palsy, that Saturday night palsy, and honeymoon palsy again. Your partner sleep on your arm like that during honeymoon. That also occur honeymoon palsy. Honeymoon palsy. Then mid-shaft fracture of humerus also causes in spiral groove. Mid-shaft humerus spiral groove. There is also your radial nerve injury occur. So what affects their radial nerve injury occurs? So see here. Okay, see here. Okay, if your radial nerve injury occur, your elbow in axilla, your elbow will not extend, elbow will be flexed, wrist will be flexed, wrist drop, finger drops. All this will be like this attitude will be there most probably. Okay, finger drop, wrist drop, elbow in flex position, elbow will not be extended. So if his injury occur here, upper is here. If injury occur in lower, somewhere you suppose if injury occur above just above the elbow. So your position your wrist drop only, wrist drop, finger drop, wrist drop and finger drops. Okay. So this main thing about your radial nerve, and many other maybe examinations I may missed, but these are the main thing about radial nerve. We have to know. Okay, thank you.